to be here, and I want to thank CNSA for I'm just putting your hand down here, Kirsten, for inviting me and being interested in sharing this information about your transition to practice. So I am not here to frighten you. I just want to be really clear about that. The intent of what I'm going to say is fairly, I say fairly because I just want to be humble about it, but it's honestly very substantiated. I've done 14 studies in the area of new grad transition in my career. I'll show you a little bit about that because they asked me to talk about my career a bit. And so I think I can say quite confidently that these are stages that you'll go through. What I can't tell you is how long you'll stay in one stage over another, how many of the properties of one stage you'll pull into another, or when you get into a new situation that you might be pulled back into feeling some things from a previous stage. But I'll go through that and you'll understand what I'm talking about. So this is what I was asked to do. What did my entry to practice look like? And how did my career progress? And what challenges do new nurses face today? So the first question, what did your entry to practice look like? Well, you know, honestly, this is actually, it's not an actual picture of me, but it looks exactly like my picture when I was a little girl. And this is just such a perfect example because she's so excited, but yet there's this, oh my Lord, what have I gotten into look, right? Do you see that? That's why I think it's perfect. Okay, my transition. Well, you know, I remember it actually quite well. I remember one particular shift, and I'll talk a little bit about this when I talk about the progression of my career, but I grew up in Regina, Saskatchewan, and ended up taking my first position at the Plains Health Center. I do not remember if I had any introduction to this particular unit when I was a senior student, which I highly recommend. If you can do your senior practicum in the place where you're going to transition, that allows you to increase your familiarity, which makes it more predictable, which makes things more stable for you. And I'll talk about why those are important. But I don't remember that. So I'm assuming, and it was 45 years ago. Can you believe it? So there's a lot to talk about here. 45 years ago, I entered practice and I went right into I think it was like a med surg unit, but mostly surgical. And I remember it was a 10 or 12 bed unit. I was by myself. And I remember a few of the patients on the unit. I had one person who just got back from surgery and was requiring a lot of medication for pain. Then down at the end of the hall, there was an individual in 4-point restraints. Then across the hall from that person was someone who just got back from surgery with their jaws wired. And then at the very front of the unit of my particular area was an elderly woman. I don't even remember what she came in for. She didn't stay very long because she ended up in ICU. So you can just imagine, I'm walking on to this and I'm thinking, first of all, I'm in report. And they're telling me about these people, right? And I'm just nodding and I'm like, okay, yeah, can't wait. And then they go to this guy who just had his jaws wired and they say to me, oh, and the wire cutters are taped to the head of the bed. And they just move on like this, no big deal. And I'm thinking to myself, gee, I wonder how do you use those? And when will I know how to use them? Then we just moved on. And so, I mean, as a new grad, you don't ask a lot of questions because you don't want people to think, you don't know this, right? So I was like a typical new grad. I didn't ask a lot of questions. Thank you to the heavens that I didn't have to snip his jaw wires. But I ended up sending this lady on my right to ICU after hours of dealing with her going into pulmonary edema. So that's kind of like an introduction to practice. I have a really good friend. He has been in the profession for a long time. Like I'm talking 25 years. I taught him actually. Anyway, he's been in the profession for 25 years, done everything. He's done military overseas in war-torn countries. So he decided, and he did a lot of healthcare leadership. He decided that he's going to go back into emerge practice. So he's there right now. And he told me the first month of his practice, and this is a guy who really knows what he's doing. He did a lot of training for the ER, which is what you do now, and you should. And he said he was in a major transition for at least a month. So, you can imagine that is what you're going to experience in part. So I want to talk a little bit about how you kind of deal with all that. But first, they asked me to talk about my career and sort of how it's progressed. So I did this little diagram to give you a sense. Now, this is not to say, oh, look at all I've done. No, it's to say a couple of things. First of all, please note this little piece here, right? This is 79 to 85. So that's 6 years after I graduated. All I really did was clinical practice. I was very immersed in clinical practice because I knew that eventually I would want to do something else. I was drawn to education and whatnot, but I thought I need to understand what's going on in practice before I attempt to teach someone else how to deal with practice. And so I do think that whatever you do, guys, even going back to school, just think about kind of how can I get that practice base. Now, I graduated with a diploma, as you can see. So then a little while later, I started to see I had an interest. My interest was critical care and in particular transplantation. So you can see that I did a few extra certificates along the way and became a critical care nurse at AACN, American Association of Critical Care Nurses. But my main thing was I was involved heavily in transplant coordination for about 5 years. Then I realized I really wanted to teach. And so I went back and I was in clinical and I was teaching. The point being, guys, there's an advancement. It's gradual and it should be. I mean, you don't be in a huge rush, you guys. You've got your whole career ahead of you. So the only reason I point out this career path is to show you that you don't have to rush. You're going to have lots of time to do everything that you want to do. So right now, as you can see, I'm very immersed in pretty much nursing education, talking about transition, doing research in transition. That's where my interests lie. Okay. So, and if you have questions about that, put them in the chat and we can answer them along the way, or I can answer them at the end. And Kirsten, I'm assuming you'll keep track of the chat or somebody will. Thanks. I think you said that. All right. So I thought this was kind of a cute little depiction of the stuff that they don't teach you in nursing school, right? Because, practice, there's a reason we call it a practice profession, because that's where a lot of the stuff goes down. And I can teach you, you can teach me how to do something, but you can't teach me how to do it within the conditions of the dynamic patient and family situation, the culture of my unit, the fact that I only have 10 minutes to do this because we're short-staffed and now I have to move on to something else. So those are the things that we can't teach. So this is a very typical, this is some research in 2019, and it really mirrored the research, that one quote that I had back in, I don't know, when did I start all this research? In the 90s, I think. I think it was in the 90s. It's been about 25 years that I've been doing this research on newly graduated nurses. But it's anxiety provoking, this entry into practice. Are you guys recognizing that? Are you anticipating that? Put your hands up maybe and give me a sense. I can see some people that are nodding. Yeah, exactly. And I'm glad that you understand that, right? Because I don't want you to go in eyes closed. I'd rather that you go in eyes wide open, but with strategies that can help you. So this is kind of what I want to talk about today. Now, I call the new graduates the canary in the coal mine. Do you guys know what that means? It's an adage that says if you put the canary, they used this to determine the level of mineral toxicity in the mines, which is why it's called a canary in a coal mine. They would send a canary down into this coal mine, and if the canary died, then they knew that there were issues in the coal mine. So this is kind of what I feel about new graduates. If you send them into the practice environment and they're leaving, as an educator recently said to me, by the bucketful, then you've got to ask yourself, what is killing these canaries? And I think that that's what we're trying to understand now. The environment is very aware that the transition to practice for all of you is difficult. And I'm going to talk a little bit about kind of why that is as I go through your strategies. But I believe the new graduates give us a really good sense of what is going on in practice and what we need to think about and change. So where are all the nurses? Because remember, after COVID, there was this huge exit of, I'd say, mid to late career nurses. And I was not at all surprised by that, you guys, because this was a very, very difficult time. I know that you, as students, even now, I mean, we're just getting to the post-pandemic era. So you were pandemic students. And I don't know where all of you are. Like, I'm imagining that most of you are in third or fourth year if you've come to this session. And, you were still doing some online work, probably more than you wanted to do. Not as much face-to-face clinical practice opportunities were definitely lessened during COVID, and they were really like wacky. You'd go into a unit thinking you're going into one unit. Next thing you know, you got a patient demographic that you weren't expecting. And so it was very tumultuous. And so that's why it doesn't surprise me that the nurses have decided that it's too much. So before the pandemic, the turnover, and I'm talking about new grads, was about 17%. Then in 2021, so we're talking about the first year into the pandemic, it rose to 25% for new graduates within the first year. And then it rose to 60 to 70% within that first year. So what was driving those nurses out? Right now, it's not that high, but it's definitely high in the sense that 1% is too many. I mean, seriously, we can't have any nurses leaving practice, because why are they leaving? I mean, if they're moving or they're having a child or whatever, that's different. But here are the main reasons why they were leaving, or why they are leaving, is they're fearful, which leads to anxiety. They don't feel personally safe because of a lot of the challenges with the isolation procedures and understaffing and whatnot, and they're exhausted. So what is it that the new graduates want? Well, they want a sense of purpose. They want to be able to work in a team. They want to feel like they're doing something important and impacting on people's lives. Would that be accurate to say? Ash, I'm depending on you, Alicia, Kirsten, and Pari, because you're right in front of me. So you're the designated representatives. Yeah, and so about mid-COVID to, moving into later COVID, I kind of anticipated that this would happen, because the more senior nurses who were older and had been kind of in this toxic practice environment for a while were absolutely decimated by COVID, because COVID was both personal and professional for all of us, right? It's not just that you went to work and you dealt with COVID. You came home and you changed in the garage, or you slept in the basement, or, because you didn't want to expose your families. So there was a lot of personal stake in COVID, which I think is the reason why we saw so much attrition. The problem with the attrition for me, in my head, is that now you do not have the same level of senior nursing practice experience to be mentored by. And that does concern me because that's how you learn a lot as a new graduate. So there's reduced mentorship. They're getting some of the staff shortages under control in some places, but some places still have that. And it's hard being a nurse. So we want to talk about how you're preparing yourself to take care of yourself. So you guys, these are essentially the stages that new graduates go through in the initial year of their practice. I didn't determine that it was a year. The participants determined that it was a year because I did research up to 18 months, but all of them were like tick tock, as 12 months came up. So it was the 12 months that really stood out. Now, I named the stages basically because those are the primary challenges or issues or foci of the new graduate in those periods of time. So you've got a focus on what you're doing, then you move to a focus on who you are, then you move to a focus on what do I know, and sort of consolidating yourself in, yeah, you know, it's not exactly what I thought it was going to be, but this is what I know about it now, and this is what I think I can do with that information. So within that first stage, there's an experience I call transition shock, and everybody has a varied experience of this. You know, some people like are really shocked and some not so much. Some are like, wow, okay, that's not, I didn't see that coming. But others are like, yeah, I kind of expected this. Why? Well, generally because they've had experience in the unit to which they are transitioning. That allows you to become familiar with the people, the places, the things. And that's really helpful. So I'm going to emphasize that again. The shock does not last forever. It lasts for anywhere from days to weeks, depending on how much support you have. And then in the second stage, at about 7 to 8 months, there is this experience. I always differentiate between shock and crisis, with shock being the new grad coming in and being like, oh my goodness, I don't know if I can do this, right? And then they figure out, yeah, you can do this. It might take you a while to figure it out, and you need some help because none of us do it on our own. So that's shock. Crisis is, okay, I think I have a sense of this. I got some experience under my belt. I feel pretty confident. I don't know if I want to do this. So you see the difference there. The difference is you're making a conscious decision in that second stage. The first stage is more like you're reacting to the environment. So please be aware that when you think to yourself, I can't do this, yes, you can. You can do it. We've all done it. Is it going to be hard? Probably. Nothing new and nothing substantive is ever easy. And we need to get out of this idea that things should be easy. It's okay to struggle. It's just not okay to drown. You understand? So if you're struggling, you reach out and people hold you up so that you don't go under. So the transition shock experience, as you can see, I'm going to talk about these roles, relationships, responsibilities, and knowledge. But when you look at all this, you think to yourself, well, no wonder I'm in shock, right? Because I'm going through all of these things. I'm having all of these new experiences and this new information thrown at me. And people are thinking, you know, get to it, Asha. Like, how come you didn't, I bring you a list the next day of the things that you didn't do. Well, let's hope that you don't get that, Asha. But if you do, you're like, well, I mean, seriously? What do you think? You think I'm going to be able to finish everything like you when you've been here for 4 to 5 years or 1 to 2 years? No, don't expect that of yourselves, and don't let other people expect it of you. But it's kind of a scary time, you know, that initial whoop. So be prepared for the fact that you might feel overwhelmed. You might feel very distracted by what you have to do. You might feel a bit disoriented because you're not being treated like a student anymore. You don't have the same level of support as you did. And so you're trying to adjust and trying to get that support. So that's transition shock. And again, this is a real snapshot, guys. So if you want more, I've got lots more. We can just talk about it as, one-to-one, or I'm hoping at the end of this presentation, we'll have a nice discussion. But I do want you to be aware that there are influencing factors, either making it harder or making it easier for you to transition. And those are subcomponents: roles, responsibilities, relationships, and knowledge. And I'm going to go into each one of them. The other thing, excuse me, that I need you to be aware of is that these foundational pieces will make your transition smoother. I don't know, I got to start this IV and I got to start it now, but I don't even know where the supplies are. That makes your environment less familiar and therefore less predictable. So a perfect example of this is floating. Floating is challenging for a new grad because it's exciting in that, oh, I'm going to learn so much. Well, learning is not really the goal in the initial stages. The initial stages of transition are to stabilize yourself. And trust me, you're going to be learning a lot, whether you go to a unit, 5 units, whatever. You're still, like, your learning curve is like this. So I say, I don't encourage floating for newly graduated nurses, only because it reduces the familiarity and predictability. Very often when you float, you go to one unit and you'll be there for, a number of sets, and then you'll go to the next unit for a number of sets, and then you'll go to, so by the time you get back to that first unit, it could be a month, 2 months. You've forgotten where everything is. So that is, if you have to go there and you want to go there, just be aware that it will, make things less familiar and predictable for you. So that's kind of what I wanted to say here, and consistency kind of fits in there with everything else. All right, so these are the stages. The first stage, okay. The first stage I call doing, because your focus is primarily on what you have to do. Kirsten.
There was a question in the chat about what your thoughts are in terms of new grads in resource teams.
Yeah, that's essentially the same thing as a float pool. They just call them different things. And, it's kind of a different sort of nursing, right? Because you're a resource team, so you go where the resources are needed. That's essentially what that means. So you could literally go somewhere different every day and do something different every day. Is there a high level of learning in that? Yes. Are there less expectations? Well, in some ways there are, right? Because usually if you come to a unit as a resource, you might be supernumerary, you might be given a lighter workload, but not always. And so it's a bit of a, it's a bit of a toss-up, Kirsten, for that individual that asked that question. Hope that makes sense. But if it doesn't, at the, when I'm done, bring it up again and we'll talk more about it. Okay, thanks, Kirsten. So the thing about the doing stage, which is the first 4 months, is that what you're doing is visible to everyone, right? Does that make sense? So they're watching me. They're watching what I do. They're seeing when they come on after I've been on, they're going to look at this dressing and think, what kind of doughhead changed this dressing? Or, or wow, this is great. Who did this? That sort of thing. So what we do is visible. What we think, not so much. So we're much more into the doing. And when you do it, you'll do what you know. I mean, in fact, the graduates have so much knowledge because they've got the latest evidence at their fingertips. So there's a way for you, even if an educator said, the new grad that we've got on the unit today is going to talk about the latest dressing changes techniques in the literature. Whoa, right? That all of a sudden people are coming to you as an expert on. As long as we maintain a humble posture, that will be well received. But you will be focused on what you're doing. In this stage, you're kind of Wow. I didn't realize that this is what nurses do. I'm hearing more of this right now, and I don't know why that is. This brushing up of the new graduate with, okay, I totally didn't know I would be ordering televisions for people. I totally didn't know that I would need to run to the store after my shift and grab something for a family and bring it back the next day on my shift. I mean, these are things I didn't know I would be doing. But as a nurse, the thing about that is that you are that constant. You are the only one they see all the time. So they're going to pull you into the room and ask you questions, and you're like, do you know how busy I am? I mean, seriously, I can hardly breathe with the workload that I have today. I can't actually do that for you. But as far as they're concerned, they're your only patient. And so they don't understand all of that you're going through. So you have to find a way to mediate that, to say, absolutely, but I'm just kind of giving meds right now. So can I come back at around 1 this afternoon and we'll sort this out? You don't have to do it right away. And then you could delegate it to somebody. But you are going to be asking the question about, wow, is this what nurses do? Is this what nurses are? And many are overwhelmed by that feeling. I don't know why it keeps telling me something about a security breach. Anyway, whatever. All right. The second stage. So once you've gone through that 4 months, you can imagine how tiring that is, right? So you're going to feel a little bit exhausted. And sometimes the graduates at the second stage, so between 4 to 8 months, they tend to pull back. And that's almost a good sign because it means that you have enough confidence to say, okay, folks, I need to kind of chill a little bit here because I was overwhelmed and now I'm realizing everything that I've been through. So I need some rest and some self-care. I always tell grads to book themselves a day at the spa at about 3 to 4 months post orientation, so that they're aware that they're going to be totally exhausted and they give themselves that time for self-care. And the reason self-care is difficult initially is, first of all, you're not even aware. You are just head down, blinders on, just get the job done. And then when you start to realize that you don't have to look down all the time, that you can actually do two things at once, you start to realize what's happened to you. Now, the pulling back is a good thing, and you will gradually re-enter at your own pace with your own determined values and whatnot. But as you can imagine, that second stage is one of reflection, one of, in my mind, and I tell many people this, managers and educators, grads are making decisions at this point. This is when Alicia is thinking to herself, yeah, you know what? I'm not sure that this is the place for me. Ooh, okay. As a manager or an educator, I need to know that. And I need to know why. Well, because the culture here is absolutely toxic. I mean, every day I come in, I'm afraid to come to work, etc. Well, if you can share that with someone, it may be that something about that could change and let you feel comfortable remaining. So just be aware that that is going to come in that second stage. You do need to take time for yourself. And because all of a sudden you see everything around you, the healthcare system is going to slap you across the face at this point. It's going to be like a wet towel and you're like, wow, this system, it just doesn't work. Or wow, this system on this unit compared to what my friends are saying, hands down, I want to stay here. So you are doing a lot of that. And that's why you get into this crisis place at about 7 to 8 months, because it's almost a crisis of self-development. You're thinking to yourself, okay, do I want to stay here? Do I want to stay in nursing at all, given that this is what my experience has been? So I caution you in that stage to talk to somebody, someone on your unit, someone, in a leadership role that you can say these things to safely. It might be a faculty person that you had a really good relationship with, but try to talk to somebody about it. Or you may make a decision that's not in your best interests. Okay, so I want to briefly talk about these influencing factors and what you might be able to do about them. So I'm wondering, I'm going to pull the chat up. How am I for time, Kirsten?
So I think it's till, I'm just trying to think, till
We still have about 25 more minutes.
25 minutes. Yeah.
25 minutes. Awesome.
25, yes.
Okay. So I'm just pulling up the chat so that I can see it. I'm not going to go through the previous comments, but I want to know from you, what do you think now that you kind of have a sense of the particular the first stage, you guys? I want to focus on the first stage because that's where you're at right now, is what's going to happen when I first get into practice. So when you think about the stresses and strains that you will be under, you think about the level of independent or interdependent practice that will be expected of you. You're going to have to make decisions, right? The clinical judgments and decisions that you may never have made before. You know, what would you do to help yourself through this? As someone in the first stage, thanks, Alicia, it can be overwhelming. Yes, yeah, exactly. You feel behind every shift, probably because you are. And there's nothing wrong with that, right? We need to give ourselves permission to be a new grad. I shouldn't expect that you're going to be boom on top of everything. If you were still that way at 4 to 5 months, then I need to ask myself, what is it that Alicia does not have? What is it that we have not provided her with that would allow her to feel more comfortable? So yeah, I really appreciate that. That's a great comment. Oh yeah, join your professional associations. Absolutely. Great idea, Kirsten. And have a peer. You know, there's nobody that knows your experience like a peer. The problem is that when you have two people who are drowning, chances are they'll still drown. So you might want to connect with someone who can boost you up, who can grab your safety belt and hold you up for a period of time. So yes, try to find someone who could mentor you, someone that you might feel comfortable with on the unit. And I'll get to how to do that, how to kind of familiarize with the people that are around you and how to decide who's the best mentor for you. Yeah. And sometimes they'll give you a mentor, which would be amazing. And I just want to mention right now, guys, in case you don't know, the Canadian Association of Schools of Nursing has a national residency program. Wherever you're going into practice, you should ask them, are you part of the CASN residency program? And if they say no, then you tell them to contact me, or you tell them to go onto the CASN website, and maybe even Alicia, if you could put the website for CNEI, awesome, thanks, because that's where the nursing residency program information is. And that's where you get the mentor. You get a mentor for 6 months. Same mentor, usually. If not, it's unusual. But the same mentor for 6 months, and you are face-to-face and one-on-one for the first 3 months. No exceptions. So that's really helpful. Okay, so I'm going to put up here some of my ideas. Your ideas were absolutely fantastic. Oh, Jane, boom. Yes, you want to ask a lot of questions. The challenge in the first stage is that you think about it now and you don't necessarily believe that. But the challenge with asking questions in this new environment where you want everyone to respect you and admire you and think you're a really good new grad is you probably won't ask questions, particularly if you ask a question and someone's like, wow, okay, I thought you'd know that by now. Oh my goodness. Well, I'm not asking that person another question in my life. You know what I mean? Because they have threatened my sense of self. And the sense of self that the new graduate is developing is very fragile. And I say to people, be very careful how you interact with that newly graduated nurse, because it's like it's like a child that's just growing into themselves, right? Everything that parent says is influential. And you can take a lot of the challenges that we all have, and you can go back to something that happened with your parents, with your siblings, way, way back that you've never forgotten. I can remember things that people said and did to me when I was transitioning that really hurt me, made me feel bad about myself, etc. So just be aware that that might not be as easy for you. Didn't know it was national. Yes, it's national, Kirsten. No, it's not. It's a national program, but it's institutionally run. So we give you all the tools, right? And that institution says, yeah, we want to be a part of that. Not
Okay,
even,
I wondered just because I attended the CASN meetings and I was just like, oh, okay, because I knew about the program, but I was like, I don't think it's like implemented everywhere. Does that make sense? I
okay,
feel like it needs to be.
yes, yes.
Definitely.
Feedback. Oh my goodness, I'm heading up the research on it, and the feedback is just outstanding. I mean, it's absolutely. I'm thinking to myself, wow, you just zipped through stage one like it was nothing. And stage one is really challenging if you don't have that support. So it's not mandatory. I think that's kind of what Kirsten's getting at. Your institution has to be willing to come on board, but most of it is paid for by the grant from Health Canada that we got to study it. So it's a good thing to remind people about. Oopsie, I'm just checking. Oh my goodness, there's just so many comments. Thanks, you guys. Okay, first of all, I'm going to go through some of my suggestions. If you can do your final practicum on the unit to which you're transitioning, you will be significantly advantaged. Now, you might not know. You're like, well, I don't know. I want to do my senior practicum in something that's just kind of out there because I know I'll never be able to get there. Okay, that's a trade-off, right? Because if you go there and then you go somewhere completely new, you're going to have a more difficult transition. But if you go to the place where you're going to transition to say, okay, eventually I want to get into this area of practice, but I'm going to start here with some generalized knowledge application, and just to kind of get all those things out of the way, like time management and dealing with culture and conflict management and all that, before I have to work with patients who are really unstable or something like that. So it's what I suggest, not necessarily what you'll do. Now, I do recommend that you try to get up to the anticipated patient workload at the end of your consolidation period. So if nurses generally take 5 patients, try to get up to 5. It'll just help you with time management a little bit more in that initial or that final practicum. Expect stress within the first 6 months. Just expect it. So think about self-care. Think about, what is it that I'm going to do when I'm not working? How is it that I'm going to come down after a shift that I work at? I don't care if it's community or urban acute care. You do need a time to reflect and someone to talk to. So, and this doesn't necessarily have to be a peer. It could be a senior nurse. It could be your mom or your dad or your brother if you feel really comfortable with them. It's just that they might not understand exactly what you're talking about, which might not allow it to be as helpful. Yeah, Kirsten, your comment about especially full-time positions. Yeah, a full-time position is a really, in the first sort of stage. In fact, and I'm sure that industry doesn't like it when I say this. I'm sure they don't like it when I say a lot of things, but anyways, I say them. But I'm not sure that the full-time is the best thing for a newly graduated nurse. It doesn't allow for the level of reflection and just sort of like, just take a day and just chill. It doesn't allow you as many of those. So I actually say a 0.75. Now, there are grads in my studies who've worked 0.5 or less. I do not recommend that. It's in some ways, it's easier on you, but at some point, you're going to have to feel the weight of that responsibility. So I don't recommend a 0.5, but 0.75 would be really a nice combination of rest and work. The
I
other
just
thing,
think
oh,
the only thing I would say is perhaps like the benefits though. I know you pay into benefits when you are part-time and that kind of thing is just that's one of the things that I think is on new grads' minds is due to the fact that once you're full-time, you get the benefits and all other things that come with that, right? So that is something that depending on in lieu of benefits, that kind of thing. So
yeah, it's a trade-off, Kirsten.
yeah.
Absolutely. You know, so I mean, full-time is kind of a normal thing. I just think if you can make it happen, try to keep it down to about 0.75. And there are many grads, maybe not as much anymore, that enjoy the casual nature of a casual work because they can choose the line that they do, who they work with, that sort of thing, and that allows them to control their hours as well. The challenge with that again is you might not get all the benefits that you're looking for. And I know of institutions that are actually making it impossible for you to choose anything but full-time. And that's what Alicia's saying. She's like, it's either 1.0 or 0.5. So, you know, they make it difficult for you. Well, you are in the driver's seat right now. I mean, we need nurses right now. Really, really need nurses. So if you can negotiate that, that would be great. I don't want to overstress it though. You know, 1.0 is fine. I want you to think about how you normally cope with stress. And I want you to reflect on that because some people say, well, you know, when I'm stressed, I just have a glass of wine. I understand that because I love that coping mechanism. Having said that, having a 1 or 2 or 3 glasses of wine every night just to cope with your stress might be a flag for you. So just think about how you cope. How can you plan ahead, you guys, for the roles and the strain and the stress that you're going to have? Who can you talk to about what you're experiencing? And initially, your thinking will be relatively A, B, C, D, E. You know, going from A to D might be difficult for you as a newly graduated nurse because you need to know that you're doing it as you were told because you're not exactly sure when to modify your practice experience. I want to say one thing here. When you see nurses around you going from A to C or A to D or A to E, be very careful about adopting that practice without asking them. You know, I noticed that the steps that I was taught are A, B, C, D. This is what they are. Now, I noticed that in this situation, you didn't do these particular things. And I have no doubt that you made that decision based on your experience and your knowledge of the situation. But can you help me understand that so that I'll know when I can do that next time? You see what I mean? And this is where the questions come in. Someone mentioned questioning. Start now. Start now in your classes with your friends. Ask questions when you want to make a statement. Instead of making a statement, ask them a question. Get practiced at that because questions do not threaten people. Declarative statements do. So you will get along a lot better with people if you ask them questions instead of making statements. Who are you going to debrief with? And debrief at noon, debrief later in the afternoon, and then hopefully with someone at the end of your shift. Ask people for feedback. They'll love you because they'll be like, wow, that graduate really wants to know what's going on with them. And I just give you an example here. Again, it's a question. Hey, Carol, can you watch my vac dressing this morning? I really respect your practice. That's important too, right? You're obviously asking them for a reason. Not you're the only person here that has more experience than me. So that's not really complimentary. So say something like, I really respect your practice, or I know you've been here a long time. What and when can we do this? And know your boundaries. Know that I've had enough. I can't work overtime, and I do discourage you from working a lot of overtime. And initially it's like great money, but sometimes it's not worth the stress. Balance will be hard. So if you're looking for balance initially, I think you should probably suspend that for the time being. And it's different going from being a student in terms of your roles to being a full-time practitioner. And we can't give you all those roles. We can't tell you that you're going to be delegating as a student, because nobody would be like, okay, I'm sorry, you're a student, just get it done. But when the minute you become a new graduate, there are things that you need to learn to delegate, and that role is challenging. Okay, let's go into responsibilities. When you think about the fact that you are working with multiple disciplines, there's a culture that you have going on here that you're trying to understand and be a part of. Your roles and what you're expected to do will probably be evolving. So at 4 months, they might expect you to do more tasks than at 1 month. They might even say, you need to preceptor today, or I need you to be in charge because I honestly don't have anyone that I can put in charge, that sort of thing. And, balance for you, you have responsibilities at home with your friends, with your family, and then understanding that you have responsibilities in your clinical practice to be a good practitioner. So tell me, guys, what do you think of responsibilities in terms of things that you can do? I think in general, Kirsten, those are great suggestions. And I don't know if any of you feel a little bit unsure about professional therapy, but oh, sorry, I say that again. Was someone saying something there? Nope. Okay. Regular exercise. Way to go, Kirsten. Absolutely. And that's the first thing that will go. Your sleep will go and your exercise will go. You probably aren't going to eat that well because you're not preparing. You're just so tired. So think about those really fundamental things. Absolutely. Okay. Anything else? If you're a nursing, yeah, good. Oh, Alicia, thank you very much for that. 10 minutes head up. Okay. Yeah, absolutely. Even if it's just going for walks. Absolutely. All right. I'm going to go through these. I want you, when you get into the unit that you are, in terms of your responsibilities, buddy with everyone. And I'm talking the unit clerk, an on-call physician, or a hospitalist that's on call for that day, physio, respiratory, whoever tends to work a lot in your particular area. Kirsten? Oh, nope. Okay. Sorry, I saw you take yourself off mute, so I thought you wanted to share something. No, that's good. That's good. Oh, this is a really important one. I know it's like, oh, really, Judy? Yes, really. Take food. Everybody loves food. They will love you. Even take something ethnic, right? That you would normally make for yourself, and they're like, "Wow, what is this? Oh, this is a dish that in my Dutch family is a really common one." And they're like, "Wow, thanks for sharing." Do that once a set. I swear to you, everybody will love you. Find out what your friends and family expect of you, because their expectations are going to need to be met. And they won't always let you know what those are. So ask them and let them know, hey, just so you know, this experience that I'm having for the first 4 months is going to be difficult. So I might not be as present. Let me know if there's something that you need from me that I'm not giving you. You need to know who does what. So for instance, if you need someone to help you with something, again, ensuring that you understand that they're busy too, but possibly, could you help me with this? And they're like, that's not what I do. That you'll have to ask the unit clerk for that, whatever. Then you get to know who to ask for what. Offer to do for others what you need practice in. So in huddle, you'd say, hey, everybody, and I'm going to talk more about this in a second. Hey, everybody, I want to do everyone's IVs today. That's my thing for the day. And they're like, oh, sweet. And Asha is starting 8 IVs, right? So Asha gets this boom, 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 boom experience, which is really helpful for an adult learner. Okay, relationships. Because you can ask questions at the end of this. I'm just going to go through these because I'm almost done. I want you to socialize with your colleagues. I know that that's probably the last thing you want to do because you feel like they're all judging you, but it's really important that you know who they are. Okay, so this is even more. In your relationships, I think I mentioned this with a little black book, so I'm going to just hold on. Watch everything. Don't have too many opinions in this first 4 months because people want to know that they can trust you. They want to know that you are understanding that they're the ones with the experience and you aren't. And that's a tough position to be in, but you don't have to deface yourself or, oh, yeah, I don't know, I'm just stupid about that. No, you don't need to do anything like that. Don't put yourself down, but just don't talk as much. Watch how people interact. Watch different people's practice. Watch. Spend time with your friends and family because that's going to be your grounding force, right? It can take you away from your head or your heart when you need to just chill. Who are the leaders on your unit? And they're going to be informal leaders, right? Who are they? Who do people talk to? Who do they ask advice from? Who do they stay away from? And whose practice do you respect? You know, when you look at someone and you think, yeah, boy, I'd like to be like them someday, then give them a call. Ask them to meet with you for coffee. Tell them that you'd like them to mentor you. This is an active process for you. Talk to your colleagues in the break room and document what they say to you. I know that sounds like another crazy idea, but I carried around a little black book for years, and I had everything in my little black book that I wanted. I actually made little black books for my students in their final practicum, and I would put little laminated sheets in there, and but you have to make it your own. So if there's something you really need to know, then you put it in your black book, put it in your phone, whatever works for you. A little black book can be digital as well. It's not nearly as fun though as the written book. All right. Also, if you learn something about Shrusti when you're talking to her in the break room and you say, so what's your weekend coming up like? And she's like, oh my gosh, I'm in this runathon and I'm so excited about it. Okay, well, you write down there, Shrusti, runathon. And next time you see Shrusti or you're working with her, you look her up. I know this sounds like, are you kidding me? No, I'm not kidding you. I think this is a great way to get to know people, and they think that you just remembered when you didn't. So Shrusti, you'll see Shrusti and you'll go, how was that runathon? And she's like, you remember? Wow, you're something special, right? Okay, that's a good one. Remember that every colleague has something to offer you. Everyone, even the nasty, mean ones. They are nasty and mean for a reason that has nothing to do with you. That doesn't mean you accept bullying, but it does mean that you say, okay, how do I reach underneath that face that they're putting on for me and get underneath to something that can help me? Who is your union steward? That's the person that's going to be important for you should you have any workplace issues. I would refrain from preceptorship or charge for the first stage. And you might think that that's difficult, but sometimes you just simply have to say no. Okay, knowledge application is the last one. Remember, stage 1, you are task focused. I suggest you be a master of 5. What I mean by that is whatever unit you go to, find out the 5 things that you have to do all the time. Well, this unit is always doing admissions and discharges and IVs and heparin drips. And okay, well, I've just got 4 right there. So the first couple of weeks of your practice, that's when you go to huddle and you say, okay, today I'm doing everybody's admissions. Tomorrow I'm doing everyone's discharges. The next day, et cetera, et cetera. Just because you know that, okay, I know something, does not immediately mean that I know when to do that, how to do it, who I need to get to help me to do it, or why I am doing it. So understand, for the most part, as a graduate, you know that. And that's good. I mean, you need to know that, but you might have to reach out to people to find out when, how, with whom, and why. That will always grow. It's growing every day, even though you don't think it is. Applying what you know in unfamiliar situations or even complex situations is stressful. Let's be real. And the environment is complex and chaotic. So expect that it will be a bit difficult. Pre-brief with people. Hey, Matt, I just want to run something by you. Stop Matt in the hallway. It's not going to take you more than 30 seconds. I'm planning to go in to see Mrs. Smith, and I want to ask her how she's dealing with how she feels about the fact that she just got this news that her husband died. And I'm thinking of saying this. What do you think about that? Is there something I'm not doing there? Would you suggest anything else? 30 seconds to a minute. Matt gives you a couple suggestions and you go, and then you come out and you're like, okay, I'm not going to do that again. Or, oh yeah, that worked really well. I got a good response. Mental note. Someone said this, find the policy. Figure out what they want you to do in that situation and debrief with your preceptor, your patient care coordinator, your charge person, your educator at the mid and end of day. Can you call a friend? Do you have somebody on speed dial that if you're in the middle of a really challenging situation, you're like, excuse me for just 1 minute, and you go into the bathroom, because the bathroom, nobody ever expects anything from you when you're in the bathroom. And you can cry, you can phone somebody. It's a great place to go to regroup. No SBAR, right? That's a really great way to present an issue or a problem to someone. Very briefly, guys, because I want to have time for questions, is go to Nurse in the Future, for heaven's sakes. There is so much that this is the only online resource for newly graduated nurses globally. So, but it's all focused on newly graduated nurses. So there's oh, and by the way, NTF Live, our next NTF Live is on November 27th at 2 p.m. PS or EST. Sign up for this, right? It's all about the NCLEX. And Shelley is amazing. She's a Canadian, and her business is a next generation NCLEX and NCLEX education. So by all means, join us. That is all I wanted to say. And now we can open the floor up for questions. Oh, I'm going to look at your comments. Had a castle to a new position, got a card to congratulate. Had a castle on it. I don't think I understand that, Kirsten.
So basically from your comment and just about listening to people. So we were discussing about heritage, and I found that a nurse that was leaving her position in my preceptorship to another position, this was like not even a 5-minute conversation, found out that she had ancestry in England, family had a castle, and this was like her leaving on the Friday. So I got her a card that had a castle on it. To say that, like, hopefully you'll get that castle sometime soon, and then you won't ever have to work ever again, but as a joke, because she got a new position, and she thought it was the funniest thing.
Oh, and she's your friend for life, Kirsten. She would stand behind you if you needed anything. I can guarantee that. Oh, I've got some really crazy stories about things I've done to get jobs, Kirsten, that ring of that. And I'll tell you, people don't forget that. They just don't. Castle in England, yeah. Until we apply it, we don't know. Yeah, that's very true, Kirsten. The application is really important, because that's when you start to learn. Do you remember Patricia Benner and pattern recognition? Do you remember hearing about Patricia Benner and her theory? And that's how you get pattern recognition. Is you walk into a room and at first you don't recognize anything, right? But next thing you know, you've seen 5 patients go into flash pulmonary edema, and now you have a portfolio of information about flash pulmonary edema because you lived it. You went in there, you didn't know what it was, and you're like, I don't know, there's something wrong with this person.
Yeah.
You know what I mean? And then all of a sudden you learn, oh, that's flash pulmonary edema. Well, let me
Oh,
tell you.
yeah. So that happened with the C-section for the second time when I went in. The team was well prepared because of the first one that we dealt with the week before. So it was very interesting. So I
Yeah.
felt a little bit calmer in that scenario because I was already in that scenario the week before.
Yeah, exactly, Kirsten. Just, I mean, this is learning, guys, and it's normal for you to be learning in this particular place. The bathroom has definitely, I'm getting lots of responses about the bathroom, it being a safe haven for people, that you're not really a nursing student or quite frankly a new grad unless you spent some time crying in the bathroom. That's just how it goes. And we're emotional beings. Guys might be a little bit different. My research with the men is that they do deal with stress differently than women and tend to bottle it up, which is not necessarily a good thing. Take a breath, absolutely. Okay, as a new grad, I truly couldn't imagine. Do you recommend travel nursing? Not as a new grad, no. In fact, there are a lot of travel agencies that won't hire a new grad because it's just, that's a relatively autonomous role. And I mean, I wasn't a new grad when I did Northern Nursing, and I went to about 4 outposts at different stages over a period of about 4 years. And yeah, I I have so many stories, you guys. Oh, we could just talk stories for like another hour. About things I did that I think, yeah, you shouldn't have done that, Judy, as a new grad or an early career nurse or whatever. Um, that's not one, just because you're if you think about those 4 things, you guys, stability, predictability, familiarity, and oh boy, what was the 4th one? This is a test. Okay, anybody who answers it gets my honorarium for this session. It's $100. Okay. Someone name all 4 of the foundational elements that you need to think about with everything. Oh, Ashley, you're on it, aren't you? Okay,
I
Ashley.
got it.
Okay.
Stability, consistency, familiarity, predictability.
There you go. Good job.
Okay, so you guys, my honorarium goes to Asha. Okay, so when you think about anything, any place you're going, any decision you're making when it comes to your practice, think, is this fostering stability, consistency, familiarity, and predictability for me? If it's not, you need to rethink it. You might say, it's not offering me predictability, but the patients are stable and okay, well then maybe that's what you need to do, right? So yeah, I would ask you to think about those things. Any other questions? So travel, I'd say no, not for a few years. Yeah. Anything else, guys, before we
I think Alicia had a question earlier in the chat. So if not float nursing necessarily, but if you don't have a home unit per se, but are part of a resource team, is that okay for new grad nurses?
Well, there's a couple of things to unpack in there, Kirsten. The first one is a home unit provides you with an
That
understanding.
stability, I guess. Yeah.
Yeah, stability, predictability. It provides
Mhm.
all of that, right? Because it's always the same thing that you're seeing and always the same thing you can anticipate, right? Which is
Yeah.
having said that, the resource team is a team.
Is a
So
team. So yeah.
so you do have a team there for yourself, but you are going to probably be going to a lot of different units, and you may not get the depth of knowledge that you need to start to build that portfolio.
Yeah.
Alicia.
I was gonna say that where I live, I've had a lot of friends join resource teams. They often are advertised as being the best place for new grads to learn about a lot of different areas and find what you like. Do you think that that's just like a tactic to get nurses to join it, or? Because like I know a lot of new grads who do a resource team for 1 to 2 years, and then they'll move on to an area.
Yeah. I think it's going to be harder to transition in those situations. That doesn't mean you can't do it. It's just going to be a different kind of transition. So do I think it's a marketing ploy by the institution? Quite possibly. I think a lot of things are marketing ploys by institutions to get you to go where they need you to go. They will spin it so that it appears to be that. Now, having said that, it is. I mean, it is an opportunity for a grad to see all kinds of different things. It's just that for a grad, you really don't need this. You need this as a new grad. So in my understanding of practice, of how do you become good at something? Well, you don't become good at something by being good at a lot of things. You become really good at something by being good at something. So then you can move that something. Now it's something else that I become good at. And again, if you're using that to figure out what you want to do, well, that's your goal, and that's okay too. So that's a kind of it from both sides for me, Alicia. Good question. What was the one situation that caused you to go into this trajectory of new grad advocacy? Thanks, Ancor. Oh, that's a great question. Oh my gosh. Well, that's interesting because I always loved students and I always loved teaching. But I went into my master's degree and we had to explore the research to find out what's a hole in the research that no one's answered, right? Because that allows you to develop your research. And I was just looking through critical thinking, right? Because that was an interest of mine at the time. And I found a study that said, I think it was by Maynard and Maynard. And it was a study that talked about the critical thinking of students and kind of how it took a typical trajectory to, yeah, like I'm a pretty critical thinker by the time I'm done my education. Then they did a study of those same grads at 6 months. And it had gone like this. And they didn't have an explanation for it. And I was like, oh, that's a hole. I need to look at that. So I went into my research trying to understand why newly graduated nurses have challenges with their critical thinking for that initial period. And I got absolutely pulled into their experience. I just couldn't stop hearing about it. And I understood it. I sympathized with it. I empathized with it both, and decided that they needed more support. And people didn't understand what was going on. Then I got led to Marlene Kramer, who did work on reality shock in the 1960s in California. And that's kind of what got me started, Ancor, was that seeing that study. But then when I got into the research, I was far more interested in the experience, because it was the experience of transition that was causing their thinking to drop like that. So I'm still absolutely enamored by this experience. I love all of you. I wish I could help all of you to make it easier. And I'm always here. So you can always reach out. But thank you for asking that question, Ancor. And I'm not the only one. So don't let me give you that impression, because there's so many people out there that want to help you. Don't let those few people in your life that want to pull you down, don't let them do that. You take your power back and just sort of let it slide off you if you can. You gotta develop some serious balls in this profession.
I have a question.
Yes.
So I'm going to be done my program December 13th, and I know it's so soon. And then I know writing the NCLEX in the new year. I'm a fierce advocate. Also part of the CNSA as BP. How does one go about advocating, but managing to stay, do you say, not I wouldn't say not professional, but like, you know what I mean? Like, especially if you're going into an organization where there's certain the way they see their perspectives. You know what I mean? Does that make sense?
Yeah, it totally does, Kirsten. And my advice to you is to just, like I said, watch for the first 6 months.
Okay.
No matter what's happening, just observe it
Okay.
and write it down. Say, issues with this. I was frustrated with that. I loved when I saw her do this. I loved when he told me about that. Just write that stuff down. And then when you are at about 8 to 10 months, wherever you are, you're going to have the wherewithal to say, oh, let's revisit all those things. I want to tackle a couple of them actually. And you know what? Go to the educator, go to the manager, go to some senior nurses and start to carve out, be very intentional, be very,
Yeah.
yeah. And if you are interested in leadership, absolutely. But there's nothing worse than a leader who's never done what they're leading you to do. It just, it doesn't work. And it makes it really difficult on the people that you're leading. So my suggestion, and I showed you that in my progress of my career, I spent a lot of time in practice. And even when I was teaching, I went back to practice and I taught and practiced at the same time. And I know my students appreciated that.
Yeah. Okay. Thank you.
Hey, good question, Kirsten. Anything else that we can talk about? We've got what, 3 minutes or, are we over? 10,
We
20.
are a bit over, but that's okay. If people have questions, yes, that's all right.
It looks like everybody's kind of quiet. Maybe you're just thinking. I'm sure you're just thinking. But don't be afraid to reach out. Get on Nurse in the Future. I want to see those numbers for the NCLEX session go boom after this session. I think you'll find it really helpful. Shelley's amazing. Well, have a good rest of your conference, everyone. And oh, look at that, Alicia. Hello, Munchkin. I love cats. All right, everybody, take care.
Thank you so
Thank
much,
you so
Judy,
much.
for coming in for this presentation. It was really informative. Thank you so much.
Well, it was my privilege. Thank you so much for inviting me.
No worries. Have a good rest of your day.
You too. And I hope to see some of you in the future.
For sure.
Not caring for me necessarily, because I hope I don't need that, but eventually I will.
Bye. Thank you so much.